Thank you so much, Christabel, and thank you everyone for tuning in. And thank you, Davio, for organizing this a wonderful platform for us to learn together. I'm going to take you through the communication challenges for children with autism and how inclusive communication helps to reach the learning outcomes. So the flow of the presentation is going to be as like, we are going to go through the background of the problem, and then we will go to the prevalence of communication challenges among learners with autism. And we will look at the significance of language acquisition for children with autism. And then we will look at the communication challenges among learners with autism and the role of inclusive communication for children with autism before we conclude our sharing for today. Autism spectrum disorders is a neurodevelopmental disorder that's characterized by primarily impairments in social interaction, communication, and repetitive and stereotype behaviors. This is according to American Psychiatric Association 2000, and recent data indicate that 1 in every 162 children is diagnosed with autism worldwide. And children with autism spectrum disorders have a variety of communication difficulties that have been assumed to be related to cognitive deficits. And the communication difficulties that include an inability to speak words, speaking with echolalia or repetition of words or phrases previously heard, phenomenal reversals, that is like you can't predict how they will react in a certain stimulus or in a certain phenomena, you can't predict them, and also seeming inattentiveness, as well as problem with social interaction and lack of responsiveness to external events. Children with people with autism process information in their brain differently than other people because autism spectrum disorder affect people in different ways and can range from mild to severe. There are those individuals with autism who can live independently. Previously, they used to say they have high functioning autism, or it was previously referred to as Asperger's syndrome, but currently we don't have Asperger's, it's just autism. But we have others who have been severely affected and might need a significant support throughout life. So we say people with autism share some symptoms such as difficulties with social interaction. It's really hard for them to initiate social interaction, and some shun away completely from people's or people faces. But there are differences in when the symptoms start, because some the symptoms start from when they are young, others they say it starts before they turn 3. But for diagnosis purposes, we say the symptoms must have shown before the age of 3 for someone to be diagnosed as autism. And also, they also differ on how severe they are, how many symptoms they have, and whether other problems are present. Because individuals with autism, they do have other co-occurring symptoms that accompany the condition. And it differs from individual to individual. We do say there are no two people with autism that are the same. When you have met someone with autism, you have met an individual with autism. No two people are the same. And we say the signs of autism begin before the age of 3, although some children may show hints of future problems within the first year of life. Studies conducted in Africa also revealed that children with ASD display difficulties in the areas of social as well as communicative behaviors, and parents, caregivers, and family members are the main communication partners of children with autism. And children with autism have long been known to respond to intervention that target specific skills and behavior. So there is hope for improvement if the intervention are be done early and thoroughly. And numerous studies have demonstrated the positive effect on early intervention on language development for the majority of children with ASD. And historically, it was suggested that 50% of individuals with autism do not develop functional language. However, with the advent of early identification and intervention, more recent estimates put the figure closer to 25 to 30%. And yet some studies are still reporting the figures of up to 50% of autism, individuals with autism to remain nonverbal, not developing speech. Yeah, we say not every child with autism will have a language problem. There are some who are verbal, some with mild verbal abilities, and others with low verbal abilities. Others are completely nonverbal, even after a long-term intervention in speech and language. They still don't develop language. And their ability to communicate do vary, depending upon their intellectual and social development. Some children with autism may be unable to speak. We call them nonverbal. Others may have rich vocabularies and be able to talk about specific subjects in great detail. And most children with ASD have little or no problem pronouncing words. Some are very good in pronunciations. And the majority, however, have difficulty using language effectively, especially when they talk to other people, expressing themselves. Many problems they have actually have to do with rhyming words and sentences. They may also be unable to understand body language and the nuances of vocal tones. Yes, so some confuse the body language. They don't understand when someone is happy or sad. They don't know when you mean like you're angry. They really confuse the facial expressions. Yeah, but numerous studies have demonstrated the positive effects of early intervention on language development for the majority of children with autism, with some though space evidence of long-lasting benefits. When you intervene early on language, majority develop speech and develop it well, but it needs a really thorough intervention, and they can develop very well in interacting with others. And the fact that language development can be positively affected by early treatment has tremendous potential significance, because the emergence of spoken language, we say it's one of the important predictors of intellectual development, as well as development in other areas. So once they develop language, it helps them to develop in other domains of life. Yeah. So due to the available evidence on the role of language acquisition in shaping long-term outcome, it has become important to identify the most successful strategies for facilitating language acquisition in young children with autism. Language acquisition is associated with significant improvement in other cognitive and functioning skills, including better learning outcomes in schools. Yeah, so let's see what are the challenges for the learners with autism. We say even those children with autism who develop speech and become successful in language acquisition, they still do experience significant challenges in functional language, because they can have language but fail to express themselves. Like they know all the words, they know what all the items around the household, but they will still find challenge in expressing themselves, or they will still find challenges in responding to instruction from other people. And many do struggle in sustaining reciprocal conversation. Like they will prefer to just, they will find themselves just dominating the conversation if the topic interests them, and not give room for others to come in due to the deficit in social skills and their inability to understand nonverbal cues as well as facial expression. So they won't know if you're bored, they won't know if you're not interested. They can just continue speaking and speaking because if a topic interests them. And the 4 key areas, we say the 4 key areas of challenges in communication can be explained here. Here are the 4 key areas of the challenges in the communication. The first, repetitive or rigid language. Often, children with autism can speak or will speak things that have no meaning or seem out of context in the conversation. Because they will actually speak what is in their mind at the moment of something that has been of interest to them in the recent time. You can find them counting 1 to 5 repeatedly, or you can find them like repeating a word like I'm going to school while they're eating. Or they like, if they want, they may say, do you want something to drink? Whenever he or she asks for a drink, he will not say, can I have a drink? He will say, do you want something to drink? Because they have the rigid language depending on how they've heard it and how they put it in their mind. And also they speak in a high-pitched or sing-song voice or a robot-like speech. And also the second challenge that they do face is the narrow interest and exceptional abilities. Children may be able to deliver an in-depth monologue about topic that hold their interest. If they love cars, they can talk, and they can, because once they have interest, they have hyper focus in one interest. They can tell you about dinosaurs and everything about them because that's their interest, and may not be able to give you a two-way conversation, or we may be speaking about something else and they bring in the topic of their interest, which is completely outside the context. And some of them, we say it's only 10%, approximately 10% of children have savant skills or extremely high ability in specific areas, such as calendar calculation, music, math. Some are good at animals or weather or anything, but they can have a savant ability and an abnormal ability in that area. Yeah. So the third challenge we say is uneven language development. Many children with autism develop some speech and language skills, but not to a normal level of ability, and their progress is usually uneven. For example, they may develop a strong vocabulary in a particular area of interest very quickly. Many children have good memories for information just heard or seen. Sometimes they may be able to read words before 5 years of age. We have in my school, for example, I have a child who is 2 years of age. We have not taught him to read or just teaching him ABCD, but when he see a word that's red, he say red. When he see his name, he can say his name, but he has not been through the process to learn like letters, then blending. No, he has not been taken yet by the school system to learn letters, then blending, but he can see a word and read it. But some of them, they can read but not comprehend. Just read red but not understand what does really red means. And also maybe they can fail to mix the red in a word and the red in color. But some can be good even at that age in doing that without being taught. So some are very good at self-learning. And we say, they often do not respond to the speech of others. They may be able to read like that one, a young boy I say of 2 years, but when you call him his name, he cannot respond. Or when you give him instruction, you will have to repeat or give him like 5 minutes before he responds, or you have to repeat or give him a prompt before he can act. And as a result, these children sometimes are mistakenly or thought to have a hearing problem. Yeah, so majority of children are confused that they have a hearing problem because they normally don't respond to instruction on the first hearing of it. And the fourth challenges, we say, either poor nonverbal conversation skills. Because they are unable to use gestures, they are unable to understand the facial expressions, and they normally avoid eye contact. Sometimes they appear to be rude or uninterested in people, which is not the case. When they don't show interest on your face, it really does not mean they're not interested in you. It's just that maybe they get certain sensory feelings when they see people's faces, then that's why they try to avoid. And majority of them are inattentive, but it's one of the conditions that is normally co-occurring with autism is ADHD. If what you really want them to give attention to is something that is of interest to them. But without, and we know without meaningful gestures or the language to communicate, many children with autism become frustrated in their attempts to make their feelings and needs known. So it's quite common to have children with ASD throwing tantrums because they can't express themselves, or being anxious because they have a need, like maybe they want to go to toilet, but they can't find words to say. Or maybe they are in pain, maybe they are sick or something, they have a pain in their body, but they can't find words to express it, even if they are verbal, even if they have language, but they can't find a way to express it. And so they normally live with like a lot of meltdowns, we call them, like crying, and as a way to express what they want or how they feel. So we say, how are the speech and language problems of ASD treated? We say, if a doctor suspects a child has autism or other developmental disability, he or we usually recommend that they see a speech and language pathologist. And the first thing they do is to assess the hearing and to assess the speech, to know if they are functioning well. And if after the assessment, they will assign them to these speech and language pathologists to take them through the training to develop the speech and language. And in addition to this, they make a referral for ideological testing to make sure that the child hearing is normal, because some of them might have autism, and hearing problems as well. So that's why it's very important to check. Yeah, so what's the role of inclusive communication? We say teaching children with autism how to communicate is essential in helping them reach their full potential. And there are different approaches to improve communication skills. And we say the best programs are the one that begins early, when the brain is still developing, and during the preschool years, and is tailored. The program must be tailored according to the child's age and child's interests. Notice that they do have very narrow interests, and they really have problem adjusting to new things. So we do focus on what works for the child, for the particular child, and we plan the program around that. So we say the program will also address both the child's behavior, because one of the issues that, apart from language, that children with autism struggle with is behavior issues. So the program have to address the language issues as well as the behavior regulation. And also we do offer regular reinforcements for positive action. When we want them to perform a positive behavior, then one and the most dominant strategy that we use is positive reinforcement. And we say most children with ASD respond well to highly structured, specialized program. They love routine. They thrive in structure. They love things to be done same way every day. And you have to prepare them before you introduce changes. Because once you disturb their routine, it's one of the things that make them to be very irritated and very frustrated. So teaching children with ASD communication is one of the significant things to do in order for them to thrive in other areas. And there are studies that have shown that once a child with autism develop language or the means of communication, it helps them to develop well in other areas of life as well. So we say for younger children with autism, improving verbal communication is a realistic goal of treatment, because children first develop pre-language skill before they begin to use words. So we say the first skills before we teach them any kind of language, like as we speak I will speak later about sign language. The first pre-language skills that we teach children with autism need to be taught is the use of eye contact and gestures, body movement, babbling, and other vocalization to help them communicate. For slightly older children with autism, we say basic communication training often emphasizes the functional use of language, such as to hold a conversation with another person, which includes staying on topic and taking turns speaking. That's what we do for all the children who have already developed language. Yeah, so in conclusion, we say some children with autism may never develop verbal language skills. For them, the goal may be to acquire gestured communication, such as the use of sign language. And this, I should say, it's something, particularly in my country or in Africa, we are yet to know the position and the significance of sign language in helping children with autism to communicate. Currently, people and professionals are focusing on speech therapy, and they can spend many years in speech therapy. And I know of children who have been in speech therapy for 10 years and they've not developed a single word. And I try to think, like, if we had invested all that time in teaching them alternative language like sign language, we would have saved them a lot, because they would be able to communicate in different ways. So sign language, I think it's one of the areas we need to advocate so much, especially in our country, Tanzania, because I've not seen it being mentioned as one of the alternatives to communication for children with autism. But I've seen one child who I think went to study abroad, and he came because he was completely nonverbal, and he can speak well in sign language, and it helped him a lot. So there is a great hope in communication using sign language for children with autism. So for others, the goal may be communication by means of a symbol system in which pictures are used to convey thoughts. We call it a pictures exchange communication system. In short, we call it PECS, where a child can say what they want by showing a picture and get the response. So they will have to move with a lot of cards, so that every time they want something, they show it a picture. But we will still have to see a way, or I see still a gap in it, because if I want to give them instruction, I also have to have pictures as well. So it's a kind of communication that's it's only one way. And in classroom, this is what we use for teachers, because we use visuals, schedules, and what. And we say, and the last thing that it's normally used for children with autism is the computer assisted technology communication, but this also is very expensive. I've not seen it in use in my country, but I know they are available. So to speak, we can all agree that sign language is the most affordable and maybe should be the first thing we should think when we think of communication for children with autism. Thank you for listening. And
can signing skills be be an effective bridge towards developing verbal skills in children with autism?
Yes, exactly, because with the introduction of sign language, you know, sign language encourages them to face the people they are talking with, and that it will help them in social skills. Like they will learn to know, when I talk to someone, I have to look at them, or when someone is talking to me, I have to look at them. So it has improved, it will help them improve not only in language acquisition, but in social skills, learning that when someone is talking to me, I have to look at them. And when I'm talking to someone, I have to look at them, which is a skill that is lacking to them. As I told you earlier, they do shun away from facial face contact or eye contact, and you may talk to them and they can respond while not looking at you. So when we are teaching them sign language, they will know that if I talk to someone, I have to look at them, and when someone talk to me, I have to look at them, and that will be a very big improvement.
How do we dispel the common myth that teaching sign language to a child with autism or encouraging the use of pictures will delay development in expressive verbal communication?
I should say, Christabel, that there are early signs that this child will develop the verbal language quick, and there are signs that we have little hope of progress in language. As I have said, the hope for language acquisition and speech acquisition for children with autism actually is there once the intervention has begun before the age of 5. If the intervention has begun before the age of 5, there is a hope that we can succeed. So I should say that because there are a lot of issues that we will need to address to a child with autism before we can even teach them sign language, because before the age of 5 is the age that we can hardly get their eye contact. They can hardly give us so I think maybe there is an age we can all agree that it will be sufficient for us to start teaching sign language and the PECs as well. Once we have get the child attention and we have worked with the eye contact, but we say like we should not rely on just developing speech, because these individuals, they have other challenges that coming with their condition. So if we are teaching language, a child can learn up to 2 to 3 languages when they are young. They can use English at home, can learn in French at school. So I think we need to take this language, these different approaches to language as a means to communicate, and we need to use them. We got with them all together, because the good thing about sign language, when I use sign language, I also use words. So I think even sign language is much better than the PECs, the pictures exchange communication system. Because if I'm using pictures exchange communication system without using words, I'm not helping. So because I can teach a child sign language, and I can be speaking the word as I show the signs. And what I encourage, because I have seen children with autism attending speech therapy for 10 years and not developing a single word, we should not wait until we know that we have failed to find an alternative means of communication. We need to do them early and give a child at least 2 means to communicate while they're still young. It will help them much better.